Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We're here today on a summer-ish day. I don't know where summer is going. I'm very disappointed so far with summer. I'm a big summer person, and I'm not getting those summer vibes right now. But I'm excited for tonight because we're actually going to the Bellworks Fireworks 4th of July event this evening. I've never done the fireworks here, so I'm super excited for that. And hopefully this weekend, with the 4th of July weekend festivities, we'll get some warmer weather. Like I want a little pool of beach weather happening. Our podcast today is our continued partnership with Hackensack Meridian Children's Health. Our family healthcare series is all about focusing on family resources and helping parents to really understand fully different resources available for them in the community through Hackensack Meridian Children's Health for children. In the same vein, we also found it to be important to discuss information for moms, right? So mom health and focusing on moms to be and postpartum moms. And we're welcoming today Dr. Rebecca Barnett. She is an OBGYN from Hackensack Meridian in Freehold.
Yes.
Thank you so much for joining us today.
Yeah.
So we are, I'm so curious. I really have a lot of questions for you. I'm a mom. I've been pregnant twice. I had a very challenging pregnancy the first time, and my second pregnancy was kind of much more mild. But I think anyone listening today, if you are a new mom or a new mom again, right? Maybe it's been a little while since you've had a baby and things change, right? New reports come out, and it's always kind of ever changing, and you're learning more about, what to tell expectant moms. So I'd like to start with your practices in Freehold, and what's your favorite thing about being an OB right now in today's age?
I don't know that being an OB has changed. I think the best part about being an OBGYN is getting to be a part of a woman's lifetime, like taking care of her throughout all of her stages of life, from being a young teenager and maybe having menstrual issues to maybe helping her through her first pregnancy.
Right.
And then, maybe down the line, she has kids, you're taking care of her kids. It's really awesome.
So the whole cycle of motherhood.
Basically, yeah. Just like
that.
Helping somebody through their entire lifetime. And being a woman myself, I think it's super rewarding to kind of, learn from my own experiences, help kind of teach back to. I think when I was pregnant twice, I found that I could even give more personalized advice and reassurance about I felt that too, and I felt the same way.
Yeah.
And it just added so much more to that experience.
Yeah, you had
it was
more
already
insight.
Rewarding before, but even so much more going through all of that stuff myself.
Right. Because you learned, right, like what you knew in school, and then obviously going through your residency and stuff. But having firsthand experience is valuable for sure.
Totally. And I think the patients value it too, like that you're not just regurgitating textbook information, that you're also talking about I went through that, or I've helped other people through this, and you're going to be okay.
Yeah. So for so many women, it depends on who you speak to, right? There are women that I love being pregnant and they're glowing, and it's you're well, I did not have that same experience. And then other women who are oh my gosh, I hope I'm never pregnant again because it was awful. I could probably say, I don't know if I had both experiences, but I had my son when I was 20. I was in college, and right away I got, within, I guess the first 3 to 4 weeks, I had very severe what they call as I don't even know how you pronounce it, hyperemesis gravidarum. Is that right?
Yes,
I got
yes.
it. Okay. All I knew I was super sick. And I was telling you a little bit earlier, my physician at the time kind of dismissed my initial symptoms and I was losing weight. And it was a very, very serious situation that very quickly got remedied. And I was put on like a medicine pump that was pumping like anti-nausea drugs into my system and like an IV at home. And it was pretty crazy. So I was losing weight and couldn't keep anything down. Luckily, it did dissipate when I was like around 14 weeks.
Right. That's usually when it goes away.
Yeah.
But rarely some women continue to have some symptoms, but most
there
people
are
get
some
better.
That like it like continues through the pregnancy, right? Yeah.
I mean, that severe of symptoms is pretty rare. The majority of people might have some like little bit mild queasiness, maybe like a little upset in the morning, but like most people aren't to the extreme that you had.
Yeah.
Definitely yours is the more rare.
It was
the more rare experience.
Intense. And I remember just like being shocked, like this is awful. But when I had my daughter, when I was 30, I was a little mildly nauseous, but like not very much so. And just really tired, but like kind of more textbook, I guess, like symptoms.
That's pretty standard.
But really fearful when I found out I was pregnant because I was, I'd established career at the time and I was on the road and, I was nervous I was going to have to like go out on disability because there was no way if I was feeling the same way that I'd be able to perform at my job. So like two totally different things. But why is that like that some women experience like such different pregnancies? Is that common that like you can just have all these different symptoms and like different pregnancies or?
I mean, yeah, it's totally possible. I mean, we have patients who've had multiple pregnancies and they'll even tell you firsthand, like every pregnancy is so different. So we usually reassure people that each pregnancy is different, kind of wait to see how you feel, let us know if you're having any concerns, like with something like that, like severe nausea, vomiting, kind of getting to it early is really important. And you never know without having known maybe you did different things the second time to prepare your body for the pregnancy that you didn't the first time. And maybe that's why it was a lot better. You know, maybe you were better hydrated or maybe you were taking your prenatal vitamins ahead of time. That's been shown to decrease nausea and vomiting in the first trimester to be on a prenatal vitamin a few months ahead.
Oh, interesting.
So perhaps you were like a little bit more prepared, in your second.
Yeah, that makes sense. I mean, yeah.
And you said you had a boy and then a girl, right? So maybe the fetal sex had some impact on it.
Interesting.
I mean, but you never really know.
Right. So true. So obviously that is an extreme example, but becoming pregnant and that time in your life can be really exciting, but it can also be, not daunting, but just kind of, something that you don't really know what to expect, especially at the first time. Prenatal vitamins are important. What do you tell, your patients initially when the first visit, right? Like what are the guidelines now that you're telling your patients to do?
Make sure you're on a good prenatal vitamin. Some patients will bring in their bottle and make sure that, it's the correct thing. I think the main thing is as long as it has more than 400 micrograms of folic acid, that's kind of key. And especially up to 12 weeks, that helps prevent spina bifida. And basically stay really hydrated, eat a good balanced diet. For patients that are having, more nausea, vomiting symptoms, a lot of times they're kind of sticking more to carbohydrates because that's really better tolerated. And so we kind of give them a pass on that for the first trimester. And hopefully their symptoms will pass and they'll get more balanced diet as the pregnancy continues. Kind of light exercise is okay. At the first visit, we review things that are safe, unsafe. So if they're on any medications, they need to stop right away or using any products that they shouldn't be. We can review things if they have specific questions.
Okay. And if they are experiencing any type of nausea, what are some of the things that tend to, I know ginger related things they say and toast or eating in the morning or I don't know. It's different for different people, I guess.
I think the biggest things I tell people is try not to be fasting at any point in time. Try to kind of always be grazing a little bit, constantly be drinking. Actually, lack of food and water can make you more nauseous, not eating and drinking.
Okay.
So I think people are fearful to eat and drink because they know they're going to be nauseous, but actually by eating continuously, little bits of food all day is actually better to prevent the nausea. ACOG, American College of Obstetrics and Gynecology, has a whole an algorithm of different medications, and depending on symptoms we can initiate certain medications to help if you're having nausea and vomiting. So depending on somebody's symptoms, at the first visit I always ask how are you feeling, Are you experiencing any nausea? How bad is it? Are you eating? Are you drinking? Do you feel like your weight is okay? And then depending on the individual, we can initiate some medication if necessary.
Interesting. I also remember in the first trimester with both children just being exhausted. Like that, they say that pregnancy tired is like no other tired. And I found it to be so true. I just remember being so drained and so exhausted because your body is making another body. I get it. But is that like a common thread for most women, or do they not all experience that as well?
I mean, I'm sure everybody's experience is always different for anything,
Yeah.
even any condition in the world. Like everyone's experience is a little bit different. But fatigue in the first trimester is super normal.
Yeah.
But, when somebody really expresses extreme fatigue, sometimes we'll also screen, thyroid or anemia to also make sure that there's not other causes, like additional causes for fatigue.
Mm-hmm.
And then sleep hygiene is also really important, too, to make sure that they are getting proper sleep or if they're having any issues with that.
Have you noted, at what week can they find out the sex?
So it depends, actually. So some women elect to do non-invasive prenatal screening or testing. And with those tests, they're very advanced. You can get fetal sex information as early as like 10 to 12 weeks.
Oh, wow.
But, on an ultrasound, it's usually around 18 to 20 weeks that you can find out.
I thought it was earlier than that. Okay, that's interesting. Are most women still finding out the sex?
I would say majorly, yeah. Most
Okay.
people are really excited. The gender reveal is huge these days.
That's true.
Everybody's super excited to find out exactly what they're having right away, but not personally to find out, and then give that information to somebody else so that they could, eat it into a cupcake and find out, or
So you
pop
have
a
to, like, write it
balloon or
down.
have a party. And yeah,
Oh, that's so
like
funny.
the most exciting thing.
That wasn't a thing with either of my kids, but now it's super popular. And
Yeah.
with my daughter, I did not find out, which I loved. I thought that's like the best surprise at the end when you like no idea. Although I did kind of really want a girl.
We have a lot of patients that do both. Literally, I would say we have tons of patients that are excited to find out right away. And we have a ton of patients who literally want to keep that secret. And it's actually really fun for us because when we deliver the baby, we get to announce what it
Yeah.
is. So it's super fun for us.
It is fun. I thought it was fun, but I was so like, I remembered that just being like, because I was convinced it was a boy. Not that I was like, but I was, I already had a boy, so I kind of wanted a girl. And
Right.
and then I was shocked, like when they said it was a girl. I was like, oh my gosh. So I was carrying like similarly, and all the I guess it's like myths that people say of like
Sure.
how you carry and like what, doing the different things. People say like, oh, that's a boy and that's a girl. But I think I looked very similar to how I had my son. So who knows? Is that like true that they say like you carry a certain way?
I've heard all of the things.
Okay.
I don't think any of it actually is real medical science.
Right.
No.
It
Not at all.
is. But sometimes it's right. I guess they have 50-50 shots.
Yeah. I think everyone feels a certain way, and sometimes they're right and sometimes they're wrong.
Yeah.
Yeah.
So let's talk about nutrition. That's a big topic. I know when I was pregnant with both of my children, I don't even know if I was into sushi at the time with my son, so it wasn't a big deal. But like cold cuts, no sushi, no raw fish, no, and there's like a larger list, I think, since over the last 20 years. So what are the big recommendations? Like what to stay away from and why?
Yeah. So, I mean, the big thing with sushi and cold cuts is really like just foodborne illness. You're trying to avoid, God forbid, a foodborne infection in your body while you're pregnant, that it could affect the growing fetus. So with cold cuts, the concern is really like listeria. It's rare, but if it did happen, you could get a condition called listeriosis. So basically the advice with that is if you're going to eat cold cuts, that you can heat the sandwich basically by heating the cold cuts, like having a hot sub, that the heat would kill off any potential bacteria on the surface, on the cut surfaces. But I do tell my patients if they get, like the pasteurized pre-packaged containers of cold cuts, then those are fine because there's not like a cut surface from a slicer where there's bacteria getting on the meat.
Oh.
So if you buy like pre-packaged meat, it's not as good as the fresh sliced stuff, but that would be considered safe. And then the concern with like sushi or like, rare burgers and stuff like that is the same thing, that there could be bacteria in there that you don't know is in there, and you really don't want to come down with an infection when you're pregnant. So kind of thoroughly cooking your food all the way through, or avoiding raw foods or undercooked foods.
Oh, interesting. So it's the same reason then for cheeses? Like, isn't that's the thing?
Yeah, like so unpasteurized cheeses. So like a lot of soft cheeses, like if you walk up to a farm and get like cheese right out of the cow. It's not a good idea because it could have bacteria in it. But most even soft cheeses that they say to avoid, a lot of them in the grocery store are pasteurized. So as long as you check your label and it's pasteurized, you can consume it.
Interesting. Okay. Obviously, a well-balanced diet is ideal. Are there any other, red flags in terms of what to not eat or to eat?
Well, I mean, I think the biggest thing is we tell people, not to consume any alcoholic beverages when they're pregnant because there's no known safe amount of alcohol to consume. So we just tell people to avoid that. With regards to certain fish, if people are into seafood, there's certain predator fish that because they eat other fish in the sea, they're higher in mercury content.
Oh.
So I know in our practice, we give kind of like a list of certain fishes that you should consume only a certain amount per week if you enjoy them. Like for instance,
salmon,
like
right?
albacore tuna is salmon's actually pretty safe. Albacore
it is.
tuna, like you'd want to have like 1 can a week if you were like really into tuna. So anyway, there's like a list. I don't know them all off the top of my head, but
that's so interesting. I wouldn't even thought of that. Huh.
Yeah, so like so that you don't consume too much mercury.
Okay.
What are the other big things?
What about peanut butter? Is that like
peanut butter is great?
It's totally fine. Okay. I was always like
great protein. Good idea. Definitely lots of peanut butter is great.
Because of the like allergies or the prevalence of like allergies, if it was like linked to people like eating peanut butter when they're pregnant, or if that's just something I heard.
I've not heard anything about pregnant women eating common allergens and having an effect on the fetus, but I do know there's a lot of literature on the children's side about like early exposure and preventing allergies.
Interesting. Okay.
That's not my area.
Yeah. And then obviously not a lot of sugar and sodas, stuff like that.
Yeah, just like generally eating healthy. I mean, your body is the vessel for your child. So you kind of want to keep your body in the healthiest form that you can. So like eating your best, doing your best, that's really all you can do.
So you said light exercise. I know some women that, run marathons while they're pregnant. They, kind of do more like extreme exercises. How do you feel about that?
Totally. So if somebody has already had a certain like activity level from the beginning, like they were already maintaining a certain level of activity, even high impact, as long as they're feeling well as the pregnancy continues, they can continue at the level they were already doing because their body is used to it already.
Okay.
So as long as, and I just tell people, listen, like your blood volume is changing, your heart rate is changing. So your ability to keep at that level may change. So if you feel like you're getting lightheaded or dizzy, you're tired, just take it down a notch. Right. Exactly. But you definitely don't want to be a couch potato type of person and become pregnant and then suddenly decide, oh, now is the time to start my high impact exercise regimen. Like you're probably not going to tolerate it very well. Yeah. But like easing into things and slowly picking up exercise is definitely reasonable.
Okay. That makes sense. I'm a runner and I did run in my second pregnancy, but it definitely, once I hit like the second trimester, my body was kind of just like, all right, like, take it down a notch a little bit. So
yeah, just like kind of listen. Like if your body talks to you, just kind of like realize, oh, okay, I'm going to listen. I'm going to do something different. Yeah. But you don't have to stop.
And it was also kind of uncomfortable to like, I don't know, like as you get bigger, like it wasn't the same.
Yeah.
But I took it down to like walking and, was still like getting active, which is, I think
usually
super
it's okay
important.
to keep doing everything unless there's some other specific concern. Like if a certain pregnancy has specific concerns where we don't want you to do as high of an impact, we would let you know.
Interesting. So are there I know nothing about gestational diabetes, but I know that it can occur in women that aren't diabetic, right?
Yes.
Yeah. So are some of those factors because of like their diet, or it just kind of occurs?
Well, so there's multiple reasons why somebody could get gestational diabetes, but we can't always predict who's going to have that condition. So that's why everyone is screened. Like literally everyone in the third trimester is screened because we don't know. But I mean, there are some women who have family history, genetic predisposition, so they may be more likely, but they still may not get it.
It's that orange stuff?
There's different flavors, but there's a glucola drink, which is a specific amount of glucose that's drunk as a challenge for your body to see. It's basically to see how you respond to glucose loads, like how your body gets rid of that sugar and if it gets rid of it at a proper amount of time. And then there's a certain level of insulin resistance that is normal in pregnancy. Like you're supposed to be able to have a little bit of a higher blood sugar so that you can give sugar to your baby. Like it's a normal change in pregnancy that happens to your body. But some women's bodies go a little overboard and they become diabetic. So we have to screen everybody.
And that's in the third trimester.
We screen in the third trimester.
Oh.
For some women who are particularly high risk, like maybe they've had diabetes in the past, we may screen them earlier as well.
Interesting. Okay. I didn't realize it was that much further into the pregnancy, but I just remember taking the test and not enjoying that, whatever that glucose test is.
There's different flavors.
You've come a long way. So we talked a little bit about nutrition, about exercise. Into the second trimester, if you are experiencing anything that you like, or I guess if you're diagnosed high risk in some capacity and are put on bed rest, what are some of the things that women are experiencing now? I was put on bed rest, but at the time I did not have a full-time job, so it wasn't as life altering for me. But it can be like a really big adjustment, right? If you have small children at home or if you are working. So what are some of the things that you tell your patients?
So bed rest actually isn't really a thing anymore.
Oh, it's not.
It was definitely being used, a while back, and research had shown that there weren't really any difference in outcomes, whether you were in the bed the whole time doing absolutely nothing or kind of doing usual activities.
Oh,
and
wow.
Actually, by laying in bed all the time, you were increased risk for other complications like getting a blood clot.
Yeah.
Exactly. So it's kind of really not advised anymore at all. For certain conditions, like maybe with the placenta, or like risk for preterm labor. Certain women are at higher risk of pregnancies, like you said. But really the bigger thing is kind of like maybe doing like light or modified activity, maybe not running 3 miles a day.
Right.
If you had a certain condition, you might just be on a light walk, or pelvic rest is another thing that's common, or no heavy lifting. But we don't do bed rest anymore.
That's so interesting.
Yeah.
Wow. I'm like dating myself. I didn't know that. That's so, that's crazy. So actually my mom is a nurse, and she used to work with high risk pregnancies, and she used to go to people's homes and all kinds of treatment, and they were all on bed rest. So it's definitely evolved a lot.
Yeah.
Yeah. And then into the second and third trimester, what are some other, things to be mindful of? I actually had a placenta tear, which was like minor at 14 weeks too, which was scary at the time, but it ended up being fine. But what are some other symptoms to be mindful of, and, when to call the doctor, when to not?
So second to third trimester, basically you might start getting Braxton Hicks contractions, which are very normal. But if you feel like you're having contractions that are more painful or more frequent than what you should be feeling, you would tell your doctor. The third trimester is also when we recommend getting a Tdap vaccine, and that's for the baby when the baby's born, to protect against pertussis. And they get their own vaccine at 3 months of age. And otherwise, kind of getting ready for, thinking about delivery, thinking about, what resources you might want to have. So I know HMH has great resources for, free classes, tours in the hospital, stuff like that that's online. So we always give like a paper when we have patients, like to let them know about resources that are available to them. Think about packing your bag for the hospital.
Yeah.
Have your go bag ready in case anything pops up, any symptoms pop up. And then kind of just being mindful of your symptoms, reporting to your doctor how you're feeling.
Right. And having, a plan in place. That's right. There are a lot of great classes and resources. I know you can take all kinds of different things to prepare for baby. And then in the third trimester, when you are nearing your due date, how many of your patients go into labor and they barely make it to the hospital, is like you see on the movies? Is that
it happens.
It does happen.
Happens.
Is it when they've had multiple children already usually, or does it happen for your first baby sometimes?
I've seen it in all. I've seen it in
Really?
first babies. Yeah, I think some people are really, everyone's tolerance of discomfort is different. I think. I wish I was more like that when I went into labor, that I had no idea what was happening. That would have been nice.
So it's a tolerance of discomfort, and that's why your body pushes the baby out more quickly?
No, I think some people have, more extreme discomfort in labor. So some people are more in pain at an earlier stage in labor, and some people actually aren't as uncomfortable until they're in later stages of labor.
I see.
They may not even realize that it's labor.
That was me. Literally, I woke up and so I was induced with my son, so I didn't really know what to expect with my daughter because there was no induction plan, and it was a healthier pregnancy. And I woke up and I had like, it was wet, but not like in the movie. Like I didn't know what it was. Like when you see in the movies that it's like this gush of like avalanche of water, which is not actually what happens. So it's like wet and I'm like, I don't know, maybe my water broke. I don't know, like what happened. It's so weird. So I called, no, I said, I guess I called my doctor and he was like, just come in at 9 if you're not sure. It was like 7 a.m. So I went back to sleep and I went in at 9 and he's like, no, your water broke. I'm like, oh my God. So it was not like the experience that I thought it was going to be.
Right.
But I wasn't having any contractions at all. And I didn't feel like that pain until like it was probably, I did have her the same day. So I guess later in the day it did. So,
Right.
And then I am a total wuss and definitely had an epidural for both. And the second one did not.
I don't think that makes you a wuss. I feel like that's very typical.
There's a lot of women in my family who went through it and didn't want the epidural. So I was kind of felt like I was like the weakling, but that's, just how I felt.
I think it's just a personal choice. And like, again, the same thing. I think tolerance of pain is just very different for people.
Yeah.
So some people tolerate it well and they can breathe through it. And maybe they've learned some techniques or they have somebody helping them, like a labor coach. That's phenomenal. But if you feel like it's too strong for you and you need any pain medication or an epidural, like definitely take it. It's there for you to make your experience better.
Yeah. So mine didn't take, and I guess that can happen sometimes too with epidurals.
I guess rarely. Yeah.
And I think they tried to make it work or whatever, but because of like the timing, like it was just not going to work out. So I was not prepared for like going through the labor pains and stuff. So that was probably the one thing from my second pregnancy that was like, I feel like sometimes too, it's like either the labor is like really intense or like the pregnancy was like a lot. And, it's like people don't have the whole thing that just they ride through and it's, glamorous and perfect.
I think everybody has their ups and downs, but not everyone talks about all their moments.
Right. That's true. So another part of pregnancy is after pregnancy, right? Postpartum or the 4th trimester. And there's a lot of, it's a huge change in your body. Your hormones are kind of all over the place. And obviously you're, not sleeping as much because you're up with the newborn. What are, some things that you tell your patients, to be mindful of to give self-care and to help themselves when they're going through that?
Yeah. So, I think the biggest thing and hot topic would be postpartum depression. And we kind of tell everyone to be, aware of their symptoms, how they're feeling, report to us if they feel like, they're not bonding well with their child or not interacting well with their family members or feeling like getting up in the morning, getting dressed, getting out. Baby blues can be normal to be a little bit like mildly down or a little bit different, or fatigue. Fatigue has a huge impact on mood. And that you're going to be a little bit more sleep deprived, like you said, because of the newborn. But to be really like communicating with your provider if you feel that your mood is not reflective of yourself or really impacting who you are or your ability to function as a new mom, I think that's very big, and you should speak up soon about that so that we could determine if it's, if it's normal and adjustment or if it's truly concerning and if you need some other resources or medication to help.
Yeah. And you mentioned earlier, some women just don't speak up and don't talk about what they're experiencing, whether or not it was, during the pregnancy or afterwards. And I think it's important to like at least have some type of lifeline and someone that you can like really, it's not, you're not like not a good mom because you're not experiencing, what maybe you thought your friend said that it was going to be great, or everyone's experience is different.
I think it's very normal to hear different things from your family or your friends or know other people who've been through something, and your experience turns out differently. And I think sometimes that's either off-putting or confusing to some women. And I think it's very important to realize that everyone's experience is really different. And realizing also that not everyone's advice or experience is going to be helpful to you. So you can take it in, you could like be aware of that advice, but sometimes you need to either figure it out on your own or get different advice for you because your situation might be different.
Yeah. No, that's so interesting. So where can moms find more information and resources within Hackensack? I can actually link everything in the conversation now, but where can they go to find information about classes and more information about your practice in Freehold?
Yeah, so online on Hackensack Meridian, we have resources for free classes, for resources, information, hospital tours. I know like our practice, we give out all that information when we have our patients come so that they're totally, like prepared and know where to get all their information.
Oh, that's perfect. Okay. Well, thank you so much. This has been so helpful. I learned a lot. There is so much that has changed and that I had no idea. So I hope everyone that's listening, can take a little bit of a tidbit of information and know that pregnancy is beautiful and amazing and, great, but it can also be, really challenging for you physically and mentally. And there is support and resources out there. And, always look to friends and family to help you through a time that can be beautiful and great and all of the messy things too. Coming up this month, we have our local beaches and pools guide. So make sure to check that out on the momwithmoms.com. We also have our outdoor dining guide running currently. Our pet care guide just launched this week. So if you have a little furry friend at home and want some information about the local vets in the area, groomers, doggy daycares, local dog parks too. We have all the dog parks in there. So I have 2 dogs at home, so definitely good for me. And I'm sure there's lots of families out there with furry friends that could use some suggestions and resources. So definitely check that out on the site. We also are launching something fun in July, so look for this. At the top of the month, we're going to be updating you with all of the new restaurants that have opened and playground refreshes and stores that are opening, right? There's always buzz. Is this opening? I heard Trader Joe's is opening. Is this opening? So we're really going to try to do the dirty work and investigate what's happening more in Monmouth County. So look for that soon. It'll be in our newsletter each month, the beginning of July, and hopefully at the top of the month every month moving forward to get in the know and find out what's going in Monmouth with the Monmouth Moms in Monmouth County. Thank you, everyone. Have a good day.